So we're back again with another Did You Know? And today we're going to be talking about deductible and out-of-pocket. So as a biller, you probably know what a deductible is. You've heard of it. Even if you're not a biller, you probably heard of deductible when it comes to your car insurance or your house insurance. But out-of-pocket is something that you may not be familiar with. But as a biller, you need to know what an out-of-pocket is and how it relates to a patient's policy. So first we're going to start off with the definitions. A deductible is the amount that the patient has to pay for services that apply to the deductible before the payer starts to pay anything. Then you have the out-of-pocket, which is the maximum amount that the patient has to pay in their policy year. If a patient has a deductible, they may have a deductible and a coinsurance. So if they have a deductible and then meet that deductible, they still may have a coinsurance that they have to pay. For out-of-pocket, however, if they have met that maximum amount of out-of-pocket, then they don't have to pay anything else for that policy year. But I will go in further about that. I'll give a little example further in the video. And also, if you don't know what a coinsurance is, you can watch the video that I'll link above that speaks all about coinsurance so you can know what that means if it gets a little bit confusing. So how are these terms used in medical billing? So first, the biller needs to make sure that they know what these terms are. Deductible and out-of-pocket, they should know what they are and if they have been met, so that they can know if the payer is paying how they're supposed to pay. That's very important. Also, a lot of times the out-of-pocket is not mentioned to the patient. So even though we should know as billers what the out-of-pocket is and if it has been met, the out-of-pocket sometimes is not really mentioned and patients don't really understand what an out-of-pocket is. A deductible is more mentioned often because it is what is upfront and patients usually meet that or have to meet that in the beginning of the services that they have with the practice. So we usually mention a lot about deductibles, but not a lot about out-of-pockets. Sometimes it takes you a little bit longer to reach your out-of-pocket depending on what your out-of-pocket amount is. So you may never meet your out-of-pocket in a policy year, and if that continues to happen, then you might never know what an out-of-pocket is. As for me, I have met my out-of-pocket one time in my entire life, and that was when I had my surgery. We'll link the video that I did about that in the cards and below. There are some people who meet their out-of-pocket every single year, but a lot of people usually don't meet their out-of-pocket. Now, if you're wondering if medical billing is right for you, then remember to schedule your remote one-on-one with me. I have 45 minutes and 90-minute sessions where you can ask me questions about schools for medical billing, what's the difference between medical billing and coding, different questions that you might have. The only thing is that this is not a consultation where I am teaching you medical billing. There will be no way for me to teach you medical billing in 45 minutes or an hour. But if you have questions about billing or you want to start a medical billing business, then be sure to check out the link in my description box and schedule your remote one-on-one. Okay, so let's do an example. So let's say a patient has a deductible of $1,000 of which none was met. They have a 20% coinsurance, and then they have a out-of-pocket of $2,000. So the patient has an in-office procedure, let's say it's 58100, and the allowed amount of that procedure is $525. This procedure goes towards the deductible. So because the patient has met none of the deductible, the patient has to pay the whole $525. That is the allowed amount, and since they have not met any of the deductible, they have to pay the whole $525. Now, the patient then comes back and has to have a procedure done in the hospital. This procedure is also going towards the deductible, and let's say it's procedure code 58150, and this procedure's allowed amount is $10,000. So because the patient has already paid towards the deductible, they've paid $525, there is $475 left to meet of that patient's deductible. So we're going to subtract the $475 from the $10,000, and that's going to leave us $9,525. Now, the patient has a 20% coinsurance after they have met that $1,000 deductible. So 20% of what the balance is, and I'll put it on the screen, $9,525, I think it is. 20% of that is $1,905. So the 20% plus the $475 that they have left to meet up the deductible would come out to $2,380. However, the patient has an out-of-pocket of $2,000. So we can't charge the patient the whole $2,380 because their out-of-pocket, meaning the max amount that they're supposed to pay out of pocket, is $2,000. So we can't charge the patient the whole $2,380 that we would have charged them. Now, I put it on the screen and I hope you understand, but if you don't, just leave your questions below because sometimes it can get a little bit tricky and confusing, especially if you're new to billing. So leave your questions below and I'll answer them. But I hope I said that clearly and you understood why we couldn't charge the patient any more than the $2,000. That is why it's so important that we understand what the deductible is and what the out-of-pocket is, and if either one has been met. Now, how do these terms relate to each other? These terms relate to each other because whoever is checking eligibility and verifying coverage need to make sure that these two terms are terms that they're looking for, that they're checking to see if the patient has met their deductible, that they're checking to see if the patient has met their out-of-pocket. So they are terms, along with coinsurance and copay and a couple other ones, that the biller needs to make sure, or whoever's checking it, the front desk needs to make sure has been checked so they can know how to charge the patient. The second one is that the deductible goes towards the out-of-pocket. So if the patient has $1,000 deductible, like we mentioned in an example earlier, that amount will go towards their $2,000 out of pocket. So they relate in that they help each other, or one helps the other one get met. The next one is first come, first serve. And what I mean by that is that whoever gets their claim in first, it's where the deductible or the out-of-pocket would apply. So for example, if I have a claim that the date of service is January 1st, and I don't send out that claim until March 1st, and then you have a claim that the date of service is February 1st, but you send out the claim on February 2nd, then if I have not, or if the patient has not met their deductible, then your claim will go towards that patient's deductible. It doesn't matter the date of service of the claim per se. What matters is who get their claim in first to the insurance company. And now let's talk about the myths. So I have 4 myths here that people have about out-of-pocket and deductible. And the first one, which I put first because a lot of people don't believe that patients will meet their out-of-pocket. So they don't really pay attention to the out-of-pocket. You know, it can be a high amount. The example that I gave was $2,000, and that's pretty low. A lot of times patients out-of-pockets can be like, $7,000, $8,000, $10,000, $15,000. So a lot of times billers don't check the out-of-pocket. But it is very, very important to check the out-of-pocket because there are patients who meet their out-of-pocket. If the patient has met their out-of-pocket, then you should not be charging the patient any more money for any services within that policy year. The next myth is that the copay or the coinsurance goes towards the deductible. Now, that is not correct because the copay is a fixed amount that the patient has to pay for that data service. So for example, I could have a visit done and maybe, some labs or something, and my policy says that all I have to do is pay a $60 copay. Now remember, if you don't know what a copay is, watch the video that I'll link above, but that is what a copay is. A copay doesn't go towards your deductible. Then you have some people who think that the coinsurance goes towards the deductible, and that as well is not true. Most of the time for a patient's policy, a patient will have a deductible and then they have a coinsurance after they have met the deductible, not that the coinsurance applies to the deductible. The third myth is that the premium or non-covered services go towards the deductible and the out-of-pocket. Now that as well is not true. So if you're a biller and a patient comes and asks questions about it, like, why am I being charged this amount? I pay my premium of $500 every month. You will be able to have to explain to them that the premium is just for you to have services covered, let me say. Your premium is like you're paying for this just in case something happens or just in case you need to use your insurance, you pay a premium. But your premium has nothing necessarily to do with your coverage. Copays, coinsurances, deductibles, out-of-pocket, all of that has to do with your policy, but the premium is just the patient paying to have that policy. And the last myth is that the deductible and the out-of-pocket are the same for in-network and out-of-network coverage. Now, I can't speak for all in-network and out-of-network coverages, and sometimes they may be the same, but for the most part, what I've seen is that the in-network and out-of-network coverage is different when it comes to the deductible. For the most part, if the patient's policy is in-network, the deductible and out-of-pocket are lower than if the patient is out-of-network, it may be higher. So if you like this video, then you'll love this video. And I'll see you again in my next one.